Hello and welcome, everyone. I want to thank you for joining us today. This is not just a presentation, it's a career pivot. Today you'll see exactly why nurse practitioners are in the most powerful position ever to launch their own telehealth practices, without the hassle, with our support, and with income, control, and independence at the center. Our company, Telehealth Medical Healthcare Solutions, LLC, is a National Management Services Organization, or MSO. We help nurse practitioners own and operate their own independent telehealth platforms. From credentialing to billing to patient sourcing, we take care of the back end so you can focus on clinical care. Why now? Because the entire country is facing a provider shortage. Why you? Because as an NP, you are already licensed to diagnose, treat, prescribe, and manage chronic conditions. And why FPA states? Because in full practice authority states, you do not need a physician collaborator. You are the top of the license. You can treat independently and legally, and we give you the platform and support to do it immediately. Full practice authority states, like Arizona, Colorado, New Mexico, Idaho, Washington, and 20+ others, allow NPs to evaluate, diagnose, treat, and prescribe without physician oversight. That means no delays waiting for a supervising MD, no paying monthly collaboration fees, no legal limits on patient volume. You're already licensed. And if you're not in an FPA state, we help you get licensed in one within weeks. Let's talk numbers. As a solo NP seeing just 5 patients per hour via telehealth, working 25-30 hours a week, you can gross $12,000, $22,000 per month. Add remote patient monitoring, RPM, and chronic care management, CCM, and that adds $150, $250 per patient per month. Recurring revenue. With just 50 patients, that can be an extra $6,000 to $12,000 monthly. We have NPs earning 6 figures working part-time from home because they onboarded in an FPA state and let our MSO support them fully. We provide credentialing with Medicare, Medicaid, and major private payers, malpractice insurance, EMR and scheduling platform, billing and claims follow-up, referrals from ACOs, MCOs, and care managers, compliance and legal support, contracted NP. All of this is included in your contract as either A, you operate under our national MSO, platform lease NP. We set it up in your name with your brand, and you keep the lion's share of income. There has never been a better time. Full practice authority laws are expanding. Telehealth is the future. Payers are looking for independent NPs to fill major care gaps. And we already have referral contracts lined up in mental health, primary care, chronic illness, and post-discharge care. The patients are waiting. The payers are ready. We just need more qualified, licensed NPs ready to say yes. Step 1. You fill out our simple onboarding form. Step 2. We credential you in 1 or more FPA states. Step 3. You're assigned a billing ID, malpractice coverage, and start receiving patients. Step 4. You start earning. It's that simple. No startup cost, no wait time, no supervision required. You became a nurse practitioner to treat patients and change lives, not to be limited by outdated policies or physician dependence. This is your moment. Join our MSO, go independent in an FPA state, and claim your piece of the telehealth revolution. Our team is available right now to get your paperwork started. Say yes, and let's get you credentialed, set up, and seeing patients in as little as 30 days. Thank you. Let's build something big, together. I'm opening the floor for your questions. Whether you're brand new or have been practicing for years, we're here to help. Let's talk about how we can make this real for you. Today, general seminar information. What is this seminar about? It introduces NPs to contracting with our MSO for national telehealth opportunities, credentialing, billing, and independent practice models. Who should attend? Nurse practitioners, FNP, PMHNP, AGNP, etc. Recent graduates and licensed NPs interested in telehealth or cross-state practice. Is this seminar free? We offer both free introductory sessions and paid deep dive workshops. Pricing ranges from $97 to $4,997 depending on the tier. Is the seminar live or recorded? Both. Live sessions include Quanda recordings are available for all tiers. How long is the seminar? 90 minutes to 2 hours depending on the tier. Will CEUs or CME credits be awarded? Not currently, but CEUs are in progress for future offerings. Is there a certificate of completion? Yes, for paid tiers. How do I sign up? Via Stripe checkout link or form provided after registration. Can I attend if I'm not yet licensed? Yes, but you must be licensed to start telehealth work. Are there limited seats? Yes. Early registration is encouraged. Contracting and telehealth opportunities. What does the MSO provide? Credentialing, billing, malpractice, tech platform, insurance panels, and patient sourcing. Do I have to bring my own patients? Optional. We provide patients through payer referrals. Is a collaborating physician required? No. Our model enables autonomous practice in allowed states. Do I need a business entity, LLC, PLLC? Not immediately. Our MSO covers infrastructure, but you can scale later. Can I work in multiple states? Yes, if you hold or obtain licenses in those states. We guide multi-state licensure. Can I still work a W-2 job? Yes. This is 1099 contract-based and flexible. Is there a non-compete? No, we do not restrict your independent contracts elsewhere. Can I work part-time? Yes, you set your own hours. Do I choose my own schedule? Yes, using our scheduling portal. Are weekends or evenings required? Only if you want them. You define your shifts. How do I get paid? We bill insurers, collect payments, and pay you bi-weekly or monthly. What's the average pay per visit? $50, $110 depending on payer, visit type, and state. Is payment guaranteed? Yes, for all billed and completed visits. How long does credentialing take? 30-90 days depending on the insurer. Who handles billing? Our MSO. You only document in the EHR. Is malpractice insurance included? Yes, with all paid tiers. Do I need my own NPI? Yes, but we help you apply if needed. What payers are included? Medicaid, Medicare, Aetna, UHC, BCBS, Cigna, Humana, and more. Can I opt out of insurance and do cash only? Yes, we support hybrid and private pay models. Do I need a DEA number? Yes, if prescribing controlled substances. Do I need to be licensed in every state I work? Yes, we help you identify compact and high-demand states. What's the cost of multi-state licensure? Varies, but we provide a cost breakdown and priority guide. Is the compact license active? The APRN compact is pending. We help you prepare now. Can I practice in my home state only? Yes, and expand when ready. Do I need to live in the state I serve? No, only licensure is required. What EMR do we use? We use a HIPAA-compliant cloud EMR system such as Creo or Simple Practice. Do I get training on the platform? Yes, full onboarding and user support. Is documentation required in real time? Within 24 hours is preferred. Do I write prescriptions through the platform? Yes, with ERX and pharmacy connectivity. Can I chart from a mobile device? Yes, mobile and desktop friendly. Do I have access to supervision or consults? Peer and clinical mentorship is available in upper tiers. Can I use my own EMR? For private pay only. Insurance billing requires our EMR. What specialties are accepted? FNP, PMHNP, AGNP, PNP, WHNP, ACNP, and more. Can I offer therapy or mental health services? Yes, especially if licensed and certified, such as PMHNP. Can I see pediatric or geriatric patients? Based on your credentials and state scope. Are chronic care, urgent care, and wellness supported? Yes, plus remote monitoring in higher tiers. Do I need prior telehealth experience? No, we provide training. What's included in the $97/month plan? Credentialing guidance, tech access, and malpractice. What's in the $497/month tier? Full billing, patient sourcing, marketing tools, and licensing help. What does the $2,197/month tier offer? Premium state expansion, 1 support and guaranteed patient flow. What's in the $4,997/month executive tier? Private label clinic setup, multi-state telehealth brand, and full back office. Can I cancel anytime? Yes, with 30-day notice. Is there a refund policy? Yes. Tier specific and provided in the agreement. Is there a contract term? 1 year preferred, month to month allowed. Can I bill under my own name or clinic? Yes, through advanced tiers or as you scale. Can I white label the service? Yes, in upper tiers. Can I bring my own clients? Yes, and keep 100% of private pay if using our platform. Do I own my patient records? Yes, if contracted through a business associate agreement. Will I be assigned a manager? Yes, in upper tiers you get an account manager. What equipment do I need? Laptop, webcam, stable internet, quiet space. Is this HIPAA compliant? 100%. Tech, storage, and communications are secure. Can I work internationally? Yes, if you maintain US licensure and meet telehealth regulations. Can I use my phone for sessions? Yes, but a computer is better for charting. Do I need business insurance? We provide malpractice. Business insurance is optional but encouraged if you scale. How do I get patients? We provide from payer contracts, referrals, and local ads. Can I market my own services too? Yes, we help with marketing templates. Do you do SEO or website setup? Yes, in executive tiers. Can I use social media for my practice? Yes, and we give you compliant guidelines. Can I advertise in multiple states? Yes, if you're licensed there. How do I get started? Complete onboarding form, upload credentials, schedule call. Is there a checklist to follow? Yes, emailed after seminar. Do you help with KKH and NPPS? Yes, step by step or done for you depending on tier. What documents do I need? License, NPI, DEA, malpractice, if owned. Resume, Idaho. How fast can I start seeing patients? 4 weeks if cash-based, 60-90 days for insurance-based. Can I get one-on-one support? Yes, in advanced tiers or add-on sessions. Do you help with taxes? No direct tax filing, but we recommend healthcare CPAs. Can I add staff or a virtual assistant? Yes, we support scaling teams. Can I join with a friend or colleague? Yes, group discounts available. Can I teach or host my own seminars? Yes, join our affiliate and educator programs. Do you support international NPs? We support US licensed NPs even if based abroad. Do I need malpractice if I already have it? No, but ours is included. Can I work under your group NPI? Yes, or your own in advanced tiers. Can I contract my own medical director? Yes, if needed for specialized services. How is this different from a staffing agency? We're a true MSO enabling you to build your practice with infrastructure and autonomy. What's the main benefit of joining? National telehealth freedom with full support and high earnings potential. Is this legit? 100%. Registered MSO, licensed providers, and documented outcomes. Can I talk to a current NP in your program? Yes, references are available. Is there a group or community? Yes, private Facebook and Telegram groups. Can I upgrade plans later? Yes, anytime. Can I get a demo before joining? Yes, book via our calendar link. Is this a franchise? No, you retain full autonomy. Do you have liability coverage? Yes, for you and the MSO. Is this good for new grads? Yes, especially for those looking to avoid traditional W-2 burnout. Do you help with school loan repayment? Not directly, but some MCO contracts qualify. Can I refer other NPs? Yes, generous affiliate bonuses included. Do I need to set up a bank account? Yes, for direct deposit. What if I'm not tech savvy? We provide training and tech support. Is this safe for patients? Yes. HIPAA and state medical board compliant. Will I get support if I get audited? Yes, billing documentation and charting logs are available. What happens after the seminar? You'll get the onboarding link, access to support, and steps to start seeing patients.